Good evening, everyone. Hi. It's wonderful to have you all here today. I am Dr. Sylvia Godson-Foley, or Dr. Sylvia, and I am a dual board certified internal medicine and obesity medicine specialist, specializing in an integrative, culturally tailored approach to obesity medicine, and also a researcher and a best-selling author. And it's my great pleasure to be here tonight with the woman of the hour, our author of the hour, Dr. Bonita Coe. So thank you all so much for coming tonight. I will be introducing her by doing her bio first, and then we'll launch into the conversation. We'll talk about 45 minutes, and then we'll have Q&A and open it up to the audience as well. You know, you all look so lovely tonight. Everyone looks great on this windy evening. And it's funny because I thought I could wait till afterwards to eat dinner, but now I'm seeing y'all eating all this good food and I'm having second thoughts. So, no, I will try not to. If you hear growling on the microphone, just ignore it, okay? It's my stomach. All right, well, without further ado, let me introduce you to Dr. Bonita Coe for those who don't know her. Dr. Coe is a practicing internal medicine primary care physician experienced in taking care of adult patients in the outpatient, nursing home, and primary care hospital setting. She has practiced in private practice and group practice settings, including academic practices, teaching medical school, and students and residents, where I met her over a decade ago at GW University. She also has served as a medical school admissions committee as well. She has spent her career seeing patients in the specialty of internal medicine for over 25 years now. It says 20 in here, 25 years, and has worked in academic settings teaching medical students and medical residents with direct patient care in clinical medical school faculty positions. She has done numerous speaking engagements in person, radio, webinars for laypersons, colleagues, and corporate audiences over the course of her career about various topics, including informing audiences about preventative health, chronic disease management, and most recently, COVID-19 and the obesity epidemic. She has written many health and wellness articles in prints and online for public-facing professional, community, and hospital platforms. She received a Bachelor of Arts in Human Biology from Stanford University. And then she got tired of the West Coast, so she came on over here to a little school called Howard University College of Medicine. She then did her residency at the Cleveland Clinic, and then also has a Master's of Business Administration from Baldwin Wallace College in Ohio. So as you can see, Dr. Coe is very qualified to write this book. So thank you so much, Dr. Bonita. It's nice to be here with you tonight.
Thank you for that lovely introduction.
You are very welcome. Yes. So I am super excited about this. I'm gonna try not to over talk to you about your own book because, as you can see, like I've highlighted, I've tabbed. It was really good. So, first question I'm actually going to open up with is, what inspired you to write "How to Help Your Doctor Help You"?
So I think over the course of my career, I became frustrated with patients coming to see me and not knowing the things that I wanted them to know for me to take care of them best. And so I started taking notes over the years, and I wrote this book over the course of 15 years. So I started with little sticky notes in my white coat, and then patients would tell me little things that would help them along the way. And I would ask them if it was okay for me to write them down. And so sticky notes turned into a Word document and turned into chapters. And then I decided that I was going to write this book because patients come to the doctor and there's so many things that people don't know. And then it became apparent to me that what people don't know is really not written down anywhere. And it's certainly not written down in one place. And so the point of the book was my attempt to write the things that I want people to know in one place, and also for them to be able to be empowered to take care of themselves better. And then by doing that, that helps me take care of them better.
I love that. And that makes so sense, right? It's so much sense. It brings it full circle because that's why it's how to help your doctor help you. Like as physicians, we can only help people based on the information that we receive. I think you say in the book, wrong information in, wrong information out, right?
Exactly. And I actually do say that to patients, meaning when you come to the doctor, you should come to the doctor and not just be a passive recipient of the healthcare. It is best, your best healthcare is when you become an engaged person and be a partner with your doctor when you are trying to take care of yourself, trying to be well and not just take care of diseases. But my focus with when I take care of patients is to help people prevent diseases as well. But it's a whole mindset when you shift from taking care of disease to prevention. And it's work. It requires you to do work. It just doesn't happen.
That doesn't sound fun. I'm teasing. No, it really is. I love what you said about we have to be an active participant in it and be partners, right? Any relationship. And really that's what it is. It's a building a relationship with your physician, with your caregiver, so that you all can synergize in a way and really work together.
And so I will interject at this point. If you look at the cover of the book, um, I actually, in my former life, I used to draw, and I actually drew the rendition of what I wanted in the book. And I didn't tell you. I actually, one day, I dreamed. I actually had a dream about the cover of the book. I woke up and I dreamed about, I wanted the cover of the book to be the patient going up a set of stairs, reaching back to help the doctor. That is how I would like people to think about their healthcare. Not the doctor leading the patient, but the patient leading the doctor. And so I woke up and I drew it out. And so I gave it to my publisher, the design team. And I actually dabbled in a little AI to help them visualize what I dreamed. And they actually came up with that book design, and it came out very well.
It is. I noticed that it has a little pink and green in it.
And I didn't tell them to do that, but they might have gone on my website or Googled me and figured something out. I didn't tell them to do it.
Really, but no, it's beautiful. I always tease her about that. So, what I really love that you said, because I say that, as physicians, really, the patient knows their body the best. Like everyone knows their body the best. What we do is give language to it. We help guide you to the right tools. And that's what I love about this because I feel like you really tear down that veil between doctor and patient, right? Like, and bring us together as one in the book. And I think that's so important to not just promote sick care, like you said, but actually to move to, or treatment, but actually to move towards healing, right? And that's what this book to me really is about, prevention, and it's about healing. So let's dive into a little bit how you get into healing. So one of the things I wanted to ask you was, what are the biggest misconceptions patients have about managing their health?
I kind of started touching on it already. Um, uh, the fact that you're powerless to make changes in your health. People think that their health is going to be what it's going to be, and that you can't make any changes, and that and you just come to the doctor and you just do what the doctor says, and you don't put any thought into what your health is going to be. And I challenge people to change that mindset. Um, and that is a big thing. Uh, I use this analogy. Um, Say you take a car, you buy a brand new car, and you park it in your driveway, and you don't do anything with that car for 20 years. A lot of times people think, if they ignore their health and they live their life, their body's just going to be great. And that is a big misconception. I feel fine. I can just live my life. My body's going to do fine. But surely, if you buy a car, park it, and don't drive it for 20 years, after that 20 years, are you going to get in that car, get on the freeway and drive it and think it's going to be safe to drive? You're going to at least have to put some air in the tires. You're going to trust those brakes on the freeway? Well, the human body is the same way. In order to maintain health, in order for it to work for you, you have to do something. It's not automatic. And so my job as a doctor is to help guide you with doing something to help you maintain your health. Now, genetics, you can't do anything about, but a big part of the book. So another misconception is that the food you eat has no effect on what your health is. A lot of people don't really think that the food that they eat affects what their health is going to be. And I try to get people to think longitudinally. So you can't just think about tomorrow. You got to think about 10 years from now, 20 years from now, 30 years from now. Because I'm a primary care doctor. So I take care of people from 17, 18 until they go on to glory. So I take care of people for a long time. We got a long time together. And so those are two big things that I try and press upon people about their health.
So you have the power, and then control what you can. You have a whole chapter on that, right? Control what you can, and don't worry about the things you can't control, which is important. And that's one of the ways you can take power. And then your food as medicine, right?
We had a discussion about that. Food as medicine.
Food as medicine. Food isn't medicine all the time. As medicine, it can be really helpful. And why don't you tell them a little bit about food? Because you really go in detail here. I love the chapters on food, especially the sugar. Anyone else with a sweet tooth? I heard a sweet tooth. I felt, oh yeah, that chapter. So many names of sugar in here.
So now, sometimes I get characterized as being kind of hardcore when I start talking about food. But what I try to impress upon people is to, especially when you've already been diagnosed with high blood pressure, you've already been diagnosed or told that your blood pressure is higher than it should be. You've already been told that you have prediabetes, or you're getting there, or you've already been told that your cholesterol is getting to where it's higher than it should be, and you may have a family history of those things, and you may have conditions where what you eat matters. You have to decide what you want in life. Do you want to eat this food, or do you want your health? I'm sorry, don't shoot the messenger. You have to decide what you want. And so that's where we were talking about food as medicine. And what I tell people, you can eat the good medicine, or you can eat the bad medicine. And it does matter. So yes, you have to think about everything you eat. Why am I eating this? Is this going to have a good effect on me, is this going to have a bad effect on me? And, obviously you're not going to be perfect about everything that you eat, but, 10, 20, 30 years, it takes a toll on your body and what you're eating. And so if there's issues with, if you're eating for boredom, if you're eating because you have anxiety or depression, or you're emotionally eating, if you're eating for things other than nutrition's sake, you have to start thinking about why you're eating, what you're eating, because it matters. It's a whole lifestyle change. It's a paradigm shift, and I love video visits and telemedicine because I have people go into their kitchen, flip those cameras around, open up the refrigerator in the pantry, and I go through. And I don't tell people ahead of time.
Mm-hmm.
I go through what's in the refrigerator, what's in the pantry. We start reading labels. It gets real. And you can't get in your feelings about it. It's not a judgment call. It's not personal, but you have to change your relationship with food.
I love that. And so I hear a lot. So there's so much to unpack in there in what you said. So one thing is like food can either help you or hurt you. So every time you're putting something in your mouth, really asking that question: is this helpful or is it hurting me? And that is a hard pause to make sometimes. But I think you talk about thoughtfulness when you're eating. And I think that's that thoughtfulness. Like a lot of times when we're bored or we're sad, mad, stressed eating, we just kind of don't think before we eat. And so I love how you bring that in, that really pausing and asking those questions. And then the other thing you keep saying, which I think we take for granted, is the relationship with food. Like there's some foods we've been dating, we've been romancing since we were like 5, 4, and now that we've grown, it's time to break up. That's what you're saying.
Break up, divorce, cut it off.
Oh man.
What I tell people is it's good every time you eat it. It's gonna be good the next time you eat it.
Yeah.
It's okay. It's okay.
But I think that's just such an important point because, so often in our profession, we are taught to kind of jump to other things before we really take a pause and think about some things like eating. And then you talk about other things. Let's talk about your trademark term in here.
All right.
Mm-hmm.
So we're jumping to what's going on up here.
It starts there. What does M.B.A. say? Free your mind and the rest will follow. That's medical fact right there, okay? So we need to start with our mind.
So I think people probably don't think about it that much, but a lot of what I do as a primary care physician is working with what's going on mentally with a person, because a lot of what I'm trying to do with a person is trying to get them to internalize what we're talking about during our visits and get them to change behaviors to improve their health. And so I was telling Sylvia, I really don't remember when this term popped into my head, but I think it was probably on a day after seeing lots of patients and having multiple conversations with people about them having difficulty in life with making choices because they are struggling with regrets they have in life. And the term that popped into my head, in medicine, you've heard the term itis. We all know what itis means. You just put itis in the back of everything. And so I coined the term in my head, regretitis. So it's actually trademarked with the United States Patent and Trademark Office, so nobody can steal it from me.
Oh, man.
I coined the term regretitis, and that is a real condition. And every physician that I've talked to, as soon as I say that word, like when I said that word to you, I don't have to define it for you because you know what that means. When you are regretting choices that you made in life. You're ruminating over choices that you've made in life. Whatever it is, it can haunt you and it can really affect um, your future health. And these kinds of issues bleed into the doctor's visit where they can bubble up into how you're making decisions and how I can have challenges managing your health because you're having difficulties changing behaviors or because what's going on with you psychologically. And so, of course, obviously, I, talk to people. Obviously, I refer people for counseling all the time to help them manage those kinds of thoughts so they can make changes in their behavior for all kinds of things with respect to improving their health. So that's my term.
I love it. And you
And
actually,
you can it causes a lot of suffering. It's a very serious condition that
well, I wanted you to actually talk about the example you give in the book because you had a gentleman who came to see you and was not seeking medical care, right? And not taking care of his chronic health issues. His blood pressure was really out of whack, everything. And he had pancreatitis because of his relationship with his mom and what he had not become her disappointment. So
right.
could you share that story because I thought it was quite profound.
Right. So the stories that I put in the book, I changed them so no one patient that I ever saw could even remotely identify themselves if they would ever read the book. And some of the stories I combined patients together. And so the story that I put in the book was a patient whose mother wanted him to be something else professionally than what he was. And that was a big internal battle with him and his relationship with his mother. And it really, really plagued him. And it was really, he wasn't coming to the doctor, he wasn't taking his medicine, and his health was suffering because of it. He didn't want to go get his blood drawn, and I couldn't manage what was going on with him without his labs, and so it was a struggle trying to help him manage his health, and his health was deteriorating because of it, and people who have this condition, you first have to give help them get some insight to let them see that this is actually what's going on because they don't see it until you bring it up. And sometimes they will see it and sometimes they won't.
And I think part of it, a lot of times we treat the head as if it's separate from the body, right? When they really are both interconnected. So sometimes people think, oh, it's a physical issue, but don't realize that they're both connected. And I think that's one great thing you do in this book is show how, oh, it's all connected. It's like the head is not separated from the rest of the body, and that's so important too. Now, let's bring up some controversial stuff because Dr. Coe, Dr. Bonita got a little saucy in here. So she had a few things that I want you to talk about here. So first, let's go to the patient is not always right.
So the way Sylvia puts it is that you want to have patients empower themselves and advocate for themselves, and then you tell them they're not always right. And so the point of that is sometimes patients have too much information, or they talk to people and they come to the doctor and they want what they want, which in itself is not bad, but sometimes what you want is not what is best for you. And so that's what I mean by the patient is not always right. And the second part of that is, um, well, what I always ask the person is, what is it that they're trying to achieve? Because sometimes they want what they want, but what they're asking me for is actually not what they need, but they may need something else to achieve the goal that they're trying to get to. And then sometimes what they want is just not correct. And then some people would just keep going from doctor to doctor to doctor to doctor until they get tired because nobody will give them what they want, or until they find, because doctors are people too, until they find somebody who they'll get them on when they're tired and find a doctor who will give them what they want. And sometimes the outcome is not good. So, um, the other chapter is called something like "Don't Bully Your Doctor."
Yes.
Is that how I wrote it?
That's how you wrote it.
So, and so I didn't actually make up that title. A patient gave me that title for the book. And the way I came up with the name of that title is she told me, I'm going to stop bullying. That's how I came up with the title. But, you know, when she said that, that was not a new concept, because that all goes back to, you know, people want what they want. So a lot of the concepts in the book I have gleaned from my patients over the years, and I put them in the book. And I think I put in the beginning of the book, one of the original titles of the book was "Pearls from My Patient," but I expanded the intent of the book and the content of the book. And then I added all the stuff about food, because I couldn't write a book like this without telling people everything I need them to know about food.
And you went there. I'm not even. She talked a lot about beef, so there's going to be some people when they read it,
They don't get their feelings hurt.
they're going to get their feelings hurt about the beef too. Yeah.
So I did have a real live registered dietitian work with me on all the chapters and content in the book that deal with food. So I did consult with someone on that, and I did modify what I wrote based on her consultation, and her input and her professional input. It just wasn't just on the side. I mean, it was professional input, and I do acknowledge her in the acknowledgments, Regina Gill, and but she agreed with me on the beef.
Well, I don't personally eat beef, so I'm fine. But I just think about, a celebrity who came after beef. Y'all remember that? And you remember all the drama that caused. So I'm looking out for you, Dr. Bonita. That's all I want to see you to be warned about with it.
The celebrity don't have a medical.
That's true. Very true.
I think she does, but she does not. At least not as far as what she told us.
Well, another thing, so, right now we're talking a lot about the patient angle and everything, but I think, especially as doctors, especially as Black doctors, we'd be remiss, like, if we don't talk about the impact of systemic racism, and also how sometimes actually we don't feel seen or heard, right, when we go to the doctor. And there's a chapter you have for dealing with this, chapter 14, dealing with mediocrity and incompetence from others when advocating for yourself. And I thought that was a really helpful chapter because, right now we're speaking in the best case scenario that you actually have a Dr. Bonita or Dr. Sylvia who's going to sit and listen to you and think about the brain and the mind and your social situations. But not everyone has that. So what would you say for patients who are in those situations where they don't experience that?
The quick answer to that is, if you're in a doctor-patient relationship where you feel that way, there's nothing wrong with changing doctors. I think a lot of times patients stay in a doctor-patient relationship like that too long without switching. There's nothing wrong with switching doctors. It is not. It is your choice about who you choose to have be your doctor. Um, Sometimes it's just not a good fit, and it could be just as simple as that. You can change doctors. You don't have to give a reason, even if the practice or the doctor asks you. You don't have to give a reason. Say, I want to change doctors. I want a second opinion. I want somebody else to take a look at my care. It's just as simple as that.
Love that. And that goes back to what you said earlier about you have the power. Because I think a lot of times people feel like they don't, right? And they have to accept who their insurance assigned or what the government assigned, but you do have the power to change and to make those choices. What are some red flags for a doctor patient relationship that might not be working?
Like you said, if you feel like the doctor is not listening to what you are saying, obviously, if you are not feeling well, the doctor is not responding to you when you're trying to communicate with them. Um, if the doctor, if you ask questions and you don't understand the questions, I understand the answers that you're getting, if things aren't making sense to you, um, if you just don't feel right about it, it doesn't have to be a whole lot.
You said one particular thing too. Let's say they do lab results and they just say, "Oh, everything's okay," and not you. You really went off on that.
That is my. Whenever you get any kind of diagnostic testing, you must get your test results. I do not like if you get any kind of test done and the doctor says, if you don't hear from me, everything's okay. That is not acceptable. You need to have something written. It needs to be in the patient portal. The nurse needs to call you. You need to have some kind of communication about your test results. You have to. That's just given to me. So, with technology in the patient portal, not just you can look in the patient portal and read the numbers. That's not good enough because those are lab reference ranges. You need a doctor's interpretation or the nurse or medical assistant explaining to you the doctor's interpretation. It's not good enough to just go read lab reference ranges. That's not good enough.
Or Google them.
Lab reference ranges are just that. It is a lab reference range. That doesn't mean that lab reference range applies to you. That is just a big thing. And the reason why I know that happens is because when you read medical records, you can see things like that written in people's charts that the doctor has said, if some kind of way, if you don't hear from me, everything's okay. Those kind of things are written in the patient's chart, and that's not good enough. That's never been good enough. I don't know where that came from.
And it can actually lead to sometimes because it's always also important too for you to double check your doctor, right? I say like your doctor may have thousands of patients, right? And we're human beings doing the best we can, but you are your number one patient too. And sometimes there are instances where doctors may have missed an abnormal lab, and then you're assuming, oh, it's okay because they didn't call me, but they actually missed it. So I think that's why I love that you empower people to do that in the book. All right, we're getting close to the question answer session. So as we lead into that, I kind of thought it would be good for you to talk about one of my favorite chapters, which is Advice for the Decades.
That's my favorite chapter too. And the reason why I wrote that chapter, Advice for the Decades, because I think that, like I mentioned, I take care of patients from early adulthood until into the season years. And life happens. And so what I've noticed after taking care of patients for 25 plus years is that people's lives often have a pattern. Certain types of things happen to people in their 20s, and certain things happen in their 30s. Certain things happen when people get in their 40s. Um, you're raising children a certain decade. A certain decade, your parents start getting older, and then you're raising kids and taking care of patients, and then of course, certain illnesses start to happen in certain times of people's lives. And so, um, certain kind of things that you need to watch out for your health or do for your health or preventive health things that you need to do for your health need to be happening at certain times of your life. And so the point of the chapter is to give people a crystal ball. So you may be reading this book at 32, but I'm telling you, think about your life when you get 50. And the point is not to scare people, but it's always better to think ahead. And even if you don't do anything about it, just the fact that you're thinking about, okay, I'm 32, but there may be a time in my life where I'm going to have to start taking care of my parents. And you can mentally start preparing for those things because a lot of times people don't think about that until their parents start having issues. And then it's a rush, 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 rush. And all of these things bleed into the doctor's visit. And sometimes I'm taking care of you, your mother, and your father. And so all of these things come into play. And it's always best to even mentally start thinking about what kind of decisions you're going to make. Are my parents going to have to live with me? Um, how is that going to happen? Um, all kinds of things. Uh, what happens if I get an illness that's unexpected? Um, when when should I start getting my mammograms and my colonoscopy? Um, all kinds of things start happening. You know, when what part of life do people start to have trouble with memory? What part of life do people start to have trouble with their bladder? What part of life do people start to have stress and anxiety about trying to work, raise kids, take care of family? You have to think about how life happens to you proactively. And so that's why I added that second part to the title.
Oh yeah, a guide for men and women to manage health proactively. Very true.
And so that's why I thought that's why I put that chapter in. So it's my way of giving you a crystal ball to start thinking about your life ahead of time. What things, patterns that may happen to you. And don't think it's not gonna happen to you. Don't think it's just gonna happen to your friends. It's gonna happen to you too. It's the pattern of life.
The circle of life. I couldn't resist. I was trying. But what I really like though about it, you made it sound how scary here. She's in her scary mode. It actually, I liked it that it was balanced, right? It was like you could get with this or you could get with that, right? So like it was really, I felt like you could see if you follow this path, it could go this way, and there may be some unexpected things that happen, but you know these things that you do positively can help you navigate it. And then yes, there's the alternative side too. So that's why I really love that chapter.
So I will add, I do tackle or raise the issue about other types of choices that bleed into the doctor's visit. Choice of job, where you choose to live, who your friends are, who your friends are not, who you choose as partners and spouses, who you pick, who you don't pick. All those things make a difference in your life, and they can affect health. So it's what I'm encouraging people as you go through your life, think about the choices that you are making. When you go to work, are you in the break room every day eating them cookies that your co-workers bring every day? I have a whole chapter. It's called "The Break Room Will Kill You."
Yes.
Stay out of the break room.
Absolutely. And that's for healthcare professionals too.
Oh,
Ours is the worst. Yeah.
The last position I had in the office, I had to stop walking to the break room.
Yeah.
When I left the office, I walked around through the patient rooms to go out the back door to get to the parking lot. I had to stop going to the break room. It was too much.
Because you're stressed, and then all that food is there, then you end up stress eating things you didn't mean to. All right. Well, we could talk forever, but I know we want to get to the Q&A section. Does anyone have any questions? Ooh, I see a hot hand up already. I guess
There's a microphone
Dr. Cole, you were very expressive about getting with your primary care doctor. But what happens when people get older and they have several different doctors, and then the records don't always follow, and they feel that they're in the middle of an abyss and they don't feel well as it is? How can the family members go about, what is the best way to bring all the doctors together so they can get consensus and understanding on what the, say, what the pharmaceuticals should be? Because some of them are fighting each other and they haven't really made it clear what's going on, because every doctor is doing their own thing and concentrating on one part of the person. Could you give some advice in that regard?
So that becomes challenging because even in our modern technological era, actually it's a little bit better because a lot of the electronic medical records can now talk to each other, but you still have to have a doctor who can knows how to try to make the records talk to each other. There a lot of places in the country we have regional databases that when you join a particular practice, you sign a waiver that says you agree to allow us to have access to your regional medical records. So if you go to this hospital down the street and then you go to this hospital down the street, I can go into the regional database and see those. But your doctor still has to take the initiative to log into that database and look at those records. With respect, that is the one of the beauties of telemedicine. So if you physically cannot go to all of the doctor visits for your family member, take advantage of telemedicine visits so you can be remotely at those telemedicine visits so you can know what's going on with the specialist. And then you really have to have a primary care doctor who's going to actively look at specialist records and actively make the effort to know what's going on with specialist records. And when you're seeing a specialist, whether in person or virtually, use those electronic medical records to at least have in the after visit summary that has a list of medicine. And at the beginning of the book, have a health folder. So when you go to your doctor, have the visit summaries of all your specialists. And we have patients who do that. They come to the doctor, they have their folder, they have all the notes from their specialists, and you can print the stuff out from the electronic medical record now. It's not a secret anymore. So that's one thing that you can do. You can have your own medical records that you can share with your primary care doctor so they can know what your specialists are doing. But you have to find a primary care doctor who is going to do that work.
I was going to say that, like, that's when the signs of a good primary care doctor is that they're willing, because the primary care doctor is the glue. That's your medical home, right? That's the terminology we're using. And you mentioned some things in here for like your first visit, for instance, old school, like bring your bag of medicines in, have all the bags of medicines. And I think that's really good because sometimes that's how we catch like duplications of medications. That's a common thing when there's too many cooks or too many doctors in the kitchen. Yeah, a lot of times. So the primary care is the one to do that. So bringing your bag of medicines, having that folder, you go through all of that in here.
And when your doctor says, where are your medicine bottles? Don't say, well, isn't it in the computer? Don't do that. When your doctor asks for medicine bottles, they want medicine bottles. They don't want what's in the computer. They don't want what's on paper. They want to see the bottles. They want to see that the pharmacist gave you what they ordered. So you don't know everything. They want to open that bottle. Sometimes we do pill counts. So y'all don't know that. We do pill counts. We read the labels. I had a patient who brought in he was switching from military care. He brought me medicine bottles in a box this big for him and his wife. And I went through every and I got rid of all of them duplicate medicines that went back to the 80s. That's how you get harmed, not throwing away medicine bottles. So when your doctor says, bring your medicine bottles to every visit, bring your medicine bottles. And when you have a video visit, have your medicine bottles lined up, ready. So I don't have to sit there and wait for you to go to the bathroom in the medicine cabinet and get your medicine. That's what I mean by be ready. That's me. That is what being engaged.
We also give some tips too, because you brought up something like have to wait. So I think time is a big factor with doctors too. So you talk about like how you can proactively like send your records ahead of time. Yeah, so that the doctor can read them before the visit, so you make the most of your time. So you talk about that in the book too, as well, and then even setting up your visit for enough time. So for a 30-minute appointment, asking for those things too.
Yeah, sometimes you don't have control over how many minutes you have, but remember, your primary care physician relationship is a longitudinal relationship. So don't feel pressed. Everything doesn't have to be tackled at that. Every visit. Remember, you're supposed to be taking notes at every visit. You've got your folder. You can prioritize things with your doctor so you can address some things at this visit. We can talk about the hangnail next time. Today, we're going to talk about your chest pain.
That's really good. Thank you for that question. That was awesome. Anyone else? Okay.
Doctor, there's a lot of conflicting information about Alzheimer's and dementia. Can you talk about the advice you give your patients and others, to keep yourself active? Because nobody seems to know how you get it. Is it preventable? What can you do to diminish the possibility of being affected with that?
We don't know. So, yeah, that's an easy answer. We don't know what causes it. It is probably multiple causes. So there's a lot of conditions that there's probably multiple causes, which obviously makes it harder to figure things out when you have a disease that has multiple causes. And then keep in mind that when you say dementia, there's lots of causes of dementia. Dementia is a specific term. It means a specific thing. Alzheimer's dementia is just one kind of dementia. So Alzheimer's is a difficult one because we don't know what causes it. Um, there is no definitive thing that you can do to prevent
Uh, Dr. Bonita, like there are certain conditions that have been shown to reduce your risk, right? So a lot of things you talk about in the book. So food, right? Weight management. So
Of
when
course.
you like you said, Alzheimer's is a particular type with tau protein that we can't even diagnose honestly till post-mortem when they do brain biopsies. That's how you can definitively diagnose Alzheimer's. But vascular
Right.
dementia, which you talk a lot about, high blood pressure, high cholesterol, diabetes, all of those put you at risk. So maybe you can share some of the things you did in the book.
So that's what I mean by there's other types of dementia. So dementia means that you're starting to have cognitive problems, and not just that you didn't remember where you put your keys. You're starting to have problems with you're driving and you can't remember how to get home. You can't remember how to put your clothes on. You're starting to have those types of functional things cognitively that are disrupting um, how you're living your everyday life. But there's many more common causes of dementia, and the big one is what we call vascular dementia, meaning decreased blood flow in the arteries that give blood to the brain. And so, same kind of thing with the heart, the kidneys. The things that increase risk of vascular dementia, high blood pressure, diabetes, high cholesterol. That's something you can do about it. He specifically asked about Alzheimer's dementia, but vascular dementia is much more common, and that type of dementia you can do something
And even with Alzheimer's, I mean, it's mixed, but they're like protective factors to like living in communities, right? There's a classic study with nuns, for instance, that live in community and they stay active, like with a repetitive routine. And when they did their biopsies post-mortem, they had signs of Alzheimer's, but they didn't have the symptoms to the degree expected. So I think a lot of the things that we started to take for granted, which you mentioned in the book, like being attached. You talked about the loneliness, like choosing to be lonely, like but community, especially as we age, is so important too.
about. So that goes back to when I started talking about choices. Um, when I talk about choices, what job you choose, who you choose to be in relationships with. The one I forgot is a big one. How you treat people in life.
That's what it was said.
It's a big deal about how you choose to treat people in life. And that bleeds into the doctor's visit. And this is how, because I'll have a patient in their 67, now, yeah, 60s, 70s, starting to have trouble with managing at home by themselves, um, having trouble remembering to take medicine, having trouble with getting to the store, cooking for themselves. And I'll say, who keeps an eye on you? Who can you call to come and load your medicine in your medicine tray once a week? Who can check on you to make sure you have food? Who can check on you to make sure you remember to come to the doctor's office? And I'm asking these questions because they're not keeping up with the instructions that I'm giving them. And people will say, I don't have anybody. And so a lot of times what I learn is that they don't have anybody, not because people have died. People don't want to be bothered with them anymore because they cut up earlier in life. So it's important about how you choose to treat people in your environment. Because when you get older and need somebody, nobody's going to be anywhere to be found.
So I should get my kids that Barbie then.
And that goes to how you treat your kids. Now that doesn't mean you let your kids run rampant. And as you know, how your kids turn out how they turn out. But that goes to friend relationships, family relationships, um, how you talk to your kids. I have patients who their kids, I've called adult children to beg them to help their parents, and they don't want no part.
That's what I said. Stop looking at me like that. I'm gonna get her to the party. Thank you so much. We have another question. Oh, right here. Please, yeah, go.
Oh, hi. So I'm a registered dietitian. I think this is just a really important topic, and I'm very happy that you had the food section in there because I just think it's so important. But one of the things when I'm working with my clients that I find is that in trying to get ask them to work and encourage them to try to eat healthier food is that they find that healthy eating is too expensive and well they think it's too expensive. I'm like the evangelist for healthy eating is actually cheaper than eating the unhealthy stuff, but that's a whole nother story. And then also just they don't like unhealthy food. So just I do cooking classes, that type of thing, just to encourage people to realize that these aren't really barriers. But my question is, how do you think that like dietitians can work closer, or do you think it's important for dietitians to work? I know you work closely with, I'm assuming you work closely with dietitians, but is there a way that we can work closer, or should we work closer with the patients that we serve? Should we work closer with their primary care physicians and their doctors and social workers? I'm always referring my clients to social workers and other, professionals, health professionals. And if so, how do you think we can do that?
So I try to refer people to dietitians all the time. And I think a big barrier is a lot of times people's insurance, the coverage is not there. Um, but I always encourage people to at least find out how much it costs to pay out of pocket. And sometimes when people find out what it costs, it 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 doesn't cost as much as they think it costs. And I think the value of seeing the dietitian or nutritionist um, is to teach people about different ways to prepare food. Because people, when I start talking to people about eating, people say, I want variety, I want variety. And so when I have people start doing food diaries just for a week, people find out that they don't, you eat the same thing every day. You do not eat anything varied. You eat the same thing every day. And so that's always funny when people realize that. And so the dietitian can help people broaden their horizons about what to eat and how to prepare the food. Because a lot of times people have been taught to buy certain foods, cook it a certain way, and they don't know anything else. And that to me is the value of the dietitian. Now, I'm going to be honest. I often have philosophical differences with the dietitians because a lot of times I'm more hardcore about what I tell people to eat than the dietitians. They're more broad about it. And not because of any kind of training issue. My perspective is different because I'm looking at the blood sugars, I'm looking at the blood pressures, I'm looking at the cholesterol, and the dietitian is looking at it a different way. Um, but we can work around that. But I think I always encourage people to seek help from a dietitian and encourage to check and see if they have HSA funds or FSA funds that a lot of people don't use, and a lot of times they can use that type of money to with their insurance to see a dietitian. Um, and Now with telemedicine, it's very convenient. And I don't know, do the dietitians do like me and make people open up the refrigerator and the pantry?
No, I think that's really powerful because I feel like we often feel like we're not regarded in the health profession.
The microphone so we can hear this so the people listening.
I was saying, I feel like a lot of times we're not regarded in the health profession as helpful because there's so many direct ways to address problems, i.e., medications and surgeries. And so it's like, and the doctors are always so busy. And so, like, to have a physician, to hear that a physician, and I think it's changing now just because we know so much more about how food impacts our health. But just to know that a physician is actually sitting here and talking and walking through nutrition labels, like that's so powerful and very much so appreciated.
But you're right. Yeah, we don't. I don't have time. So yeah.
And I think you bring up a good point too, because I think there's two problems I feel in the healthcare profession, like in medical school. Like we only got one lecture on nutrition, right? But because everyone eats, they think they know food and they don't. So that's the problem. People are not aware of what they don't know until you have exposure to actual nutrition education. And then I think the second thing, you're a registered dietitian, which you will look at the medical conditions and everything because that's part of your training. But there are a lot of nutritionists, right, that they don't do that. All they look at is the food. So it's really important. Like I think RDs, registered dietitians, or those who study it working hand in hand with a medical doctor is important. So just like you talked about that comprehensive care for patients. So thank you. Okay, I think there, and then there's one more person back there.
Hi, Dr. Coe. I have a question. How do you feel about supplements? Do you like to try to take supplements instead of prescription drugs? I'm not going to say which ones, but well, I actually will. Maybe you can tell me.
So I have a short answer for that.
It's in the book. Go ahead.
Your body wants food. I don't tell people to take supplements. Your body wants food. And I've had people say, well, I don't have time to eat all the stuff you're telling me to eat. Can I just take a pill? Can I just take a supplement? Your body wants food. Supplements don't replace that. That's my first answer to that question. I think the supplement industry is a bazillion-dollar industry. And in general, I don't think supplements move the needle for anybody. In general.
Well, you know that my day job, I will refrain from answering this. But I will say, ask you a question, though, I think knowing which ones are important, because aren't there some that are recommended to be taken? There's a wide range, right, when we're talking about supplements. So aren't there some that are recommended?
So in general, I think my answer stands. However, obviously, if you have a particular medical condition, if you have a particular deficiency, that's a whole different discussion. There are certain specialties, there are certain conditions. Your specialist is checking levels of this and that and telling you to take this and that. That's different than just saying, take this supplement as a preventive measure.
I should have been more clear.
Yes.
Okay. So my question is, for example, you have a cholesterol problem. If you want to take something like Berlin to help lower that, as opposed to trying to take the prescription for Suvastatin or something?
So I don't think there's anything wrong with that, but I always encourage people to start with what they're eating and exercise. And like I mentioned, you can't do anything about genetics. Now, the problem with supplements is that they're not studied like medications. And so a lot of times we can't hang our hat on them because we don't have the science behind it enough to say that. But berberine really bubbles up to the top to help with cholesterol and glucose control, things like chromium, cholinate. And I recommend, and I did put this in the book, there's when you start talking about reputable sources for information, I encourage people to look at a website. It's called healthline.com. It is I think it's one of the better peer-reviewed websites. Peer-reviewed meaning there are physicians and clinicians who actually read the articles, and I refer people to Healthline all the time. But reputable sources to look at online, like big institutions, hospitals, health systems often have site parts of their website for patients where they talk about conditions. Um, those are reputable places to get medical information. But be careful with supplements because, we can't hang our hat on dose and what dose is going to do what. So I'm careful about making those type of recommendations. I do tell people to let me know what they're taking so I can say if something definitely they shouldn't take, but you're kind of like taking it at your own risk. And there are some supplements that we can say are better than others. Berberine, chromium, cholinate are two of the ones that have more of a reputation of moving the needle for cholesterol and blood sugar control.
And some can interact with your medications too. So I think another thing you said, like making sure your doctor is aware, is important because some supplements do interact with your medications as well. Side effects.
But just in general, when people tell me about supplements, I want to jump back to what food you're eating first.
Thank you. That's a great question. All right.
Good. Good. I'm M.B.A. And 10 years ago, I got diagnosed with glaucoma, 4th-stage glaucoma. I was on the way to go aboard to a trip. So I was a plumber in the doctor's office. I was plumbing in the hospital. So I went to the doctor, and he told me I was 4th-stage glaucoma. And he said he wanted me to take the drops. And I was like, well, I'm getting more natural stuff. He said, right now, just take the drops and then continue it, because I don't want you to come back in here blind. All right. Then I started going to Howard University, glaucoma specialist. In about 4 or 5 years, and my doctor had passed away. I'm gonna make this brief. And then his associate took over. So I was doing that. Then there was some other stuff. I had a new personal doctor, family doctor. So she did some blood tests. So she wanted me to get some other tests, like hepatitis thing. So I did the test, and a specialist, she referred me to a specialist. It's an internal, I think that's what it was. And then they started recommending me to get certain kind of hepatitis medicine. And then I mentioned to him that I know somebody that treated hepatitis with changing their diet. All right. Then some specialists came in, some white woman came in, to try to convince me to get this medicine. And I was still like, but they didn't have my medical card for prescriptions. All right, so then 2 or 3 months later happened, and no, 2 and 3 days happened. Walgreens and Howard University called me, said, "Man, your medicine's here." I said, "What medicine?" Uh, the medicine that the doctor ordered for you. I said, "I didn't order no medicines. I don't want no medicine." All right, then I started. I couldn't get my. I went to Howard to my eye doctor to get my eye drops, and I kept going because I ran out of medicine. Kept going to my specialist, glaucoma specialist, to order my drops. And the secretary said, "I ordered the drops 5 days ago, but everybody called me, I can't get them." So, but my point is, uh, Howard University stopped me from getting treatment there. I was kind of thinking, what's going on? And then I went to my personal doctor, and I was telling her what had happened. And she was like, because she was going to refer me to Howard. And I had one another special person. I said, "No, I don't want to go to Howard. I'm through with them right now." So I said, "Refer me to another hospital because I don't want to go there." So my point is, why do you think that could have happened? And I'm gonna say about families and everything. Uh, we Africans born in America learn from other people, and our families, I believe, only give us what they got. I'm 28 years of recovery, and so I try to keep them, don't get them off the hook because they only give you what they seen and what they got in the society we live in. So that's all I wanted to say. So that's a question. Or wait, do you have some malpractice questions? Because somebody said, "Man, you might have a malpractice issue." But had to get focused because I'm more not visional in my eyes than not on my left hand side. I did laser one eye, and but I ain't upset about it. So I'm learning what the industry do, and and then somebody say my situation was genetic. So I had questions about all that, if it was or not. So that's all I have to say.
You got it. You want me to summarize?
So my first comment about everything that you said makes the point of what we've been talking about having a good primary care doctor to be the conductor of your health. And if you are not feeling that your primary care doctor is guiding your specialist and subspecialist care, is to find another one. That would be my response to kind of summarize everything that you said.
That's what I heard. Because with the medication ordering and everything, and clarifying why the medications were ordered and why they could be beneficial, all of that is what the primary care will help with too.
Well, would I have a malpractice with Howard, who just dismissed me in 57 months? I couldn't get no treatment from it.
Now, that's something that you, as far as malpractice, that's something that you would have to talk to an attorney about.
And doctors are allergic to lawyers.
Thank you. I kind of wanted to piggyback on what this lady was saying with regard to the insurance. There was a time when you could get certain services based upon what the doctor really thought you needed. And then they started this process of coding. And like if you coded it a certain way, you could get certain services. Do you think there's a real difference between doctors in terms of who understands that coding system or not, as to whether or not you can get the services?
What insurance companies do is a moving target. That's my first answer to that question. It's a game, right? So I am supposed to code based on what I did. I am not supposed to code based on what the insurance company will pay for. That I am supposed to code for what we talked about, what we actually did, what I did. I am not supposed to code regarding a reimbursement. That is a separate issue. So if I code for something and the insurance companies come back, which they always do, and tell you this was not covered because she didn't code it right. That's not correct. I coded correctly for what I did. They are not paying for what I did. That doesn't mean not mean that I didn't do it right. They said you didn't do it right. Yes, I did. And I am not changing my code. I am not allowed to finagle a code based on some reimbursement that the insurance company decides upon. That is not part of my contract with an insurance company. That is not part of my contract with Medicare and Medicaid. We are supposed to code based on what we did. We are not supposed to change it. I don't change code. No man. Yeah, they put it back on us, but that's okay.
And it's unfortunate for the patient too, right? Because then you kind of get caught in the middle and you're not getting the service you need. And I think it is right though for them to come back to talk to you so that maybe you all can see if there is a workaround or some other way. But it's a game, unfortunately. Sometimes that's what it can feel like. When the patient and the doctor gets put in the middle.
Sometimes a lot of times there's not a workaround because we're not allowed to change codes because that means I did not properly code what I did, and insurance companies don't like that. And by doing that, I jeopardize my ability to have a relationship with the insurance company, have a relationship with Medicare, have a relationship with Medicaid. And that's called insurance fraud. And Medicare and Medicaid love to put doctors in jail for doing that. They will put you in jail for doing that.
Well, excellent questions. We have time for one more. Oh, two more? Okay. If you all want to, so we can go maybe about 10 more minutes. And we want to leave some time for the book signing. And then I do want to get your final word. So start thinking about this. Your final word of what you want people to leave with. If they get nothing else from this book, from this conversation. Okay? So we're going to take these two questions.
Hello, good to meet you. And my name is Renzel. But I was prescribed recently by my doctor oxycodone and Percocet due to my injuries, and he said I'm gonna recover the rest of my life. So I was like, oh, so I'm taking that for the rest of my life. But he said don't get addicted and all that type of stuff. But I'm not. But it's just more so like I do get paranoid sometimes. Like dang, I'm not trying to take it. Like twice a week or whatever like that. Like I do my best not to even take it. I use it when it's severe, when I feel the injuries that I have, like constantly nonstop ticking like a clock, something like that. But that's when I'm like, I need to use it, and it works for sure. Yeah, I definitely calm and everything. But it's all prescribed. I'm just curious, say I take that for the rest of my life. Oh my God, I definitely got paranoid with the milligrams because I know they said don't go over 4,000, of course, and that's in the 24 hours. But I'm doing my best to just, not even take it. But like, what do you say about that? As in taking that for life? Do you think that is dangerous?
So you have an injury that has caused chronic pain that your doctor says you're going to have pain from this injury for the rest of your life.
Yeah, he said I'm recovering for the rest of my life.
And so pain has to be managed. And so one thing to consider is to see a pain management specialist.
I have, and they also they gave me that medicine because they were doing like treating me like a guinea pig or something. Right? They were like, all right, let's take this one, take this pill, throwing all these pills. I was like,
so remember what I said. If you're not comfortable,
to say no, and I definitely said no.
No, that's not what I said.
What?
Find another pain
another
management specialist.
Yeah, I did too.
They're all over the place.
Yeah, but they definitely kept on trying to go to like which prescription is the best and everything because
you can find another.
They well they gave me what they did was when the first injury happened because I was shot several times in my upper body and also hit in the head with the gun because I kept standing after he shot me and defending myself, stabbing him. It's on the news though, like I rescued citizens at a gas station parking lot. That's the thing. But okay, so yeah, I definitely defended myself and all that, but like due to my injuries, like it hurt bad sometimes, and I thank God like none of the bullets went through my chest or anything. Only bullet went through my thigh, and also I have fragments. Like one hit my collarbone, and I just broken to pieces. So it's fragments of me for life, but it's good. Like I love that. Yeah, it feels good and all that. But,
and then my other suggestion is acupuncture.
Oh, what's acupuncture?
Oh.
Acupuncture.
Acupuncture. That's another way to see an acupuncture specialist or see a naturopathic doctor or a holistic doctor, integrative medicine, complementary medicine. That's a whole different group of, those are kind of interchangeable type of doctors who look at managing health in a different kind of way. And but we can talk about it afterwards.
Yeah, I know that's right.
Fortunately, in Washington D.C. area, there's so many complementary integrative medicine specialists, and I can tell you where to go. There's lots of people who do acupuncture, and so these type of practitioners don't do a lot of medication prescribing either. But you can certainly find a different.
But what she's saying is that you could maybe work with these. It's not either or. That's why it's called complementary. So working together.
You could do. You could see your pain management doctor and see the holistic doctor and get acupuncture. You can do all of that. But we can talk about that later.
Thank you for your question and for your bravery too. Yeah.
All right, I think we have one right there. Any suggestions, tips for how to find a good primary care doctor? How, where?
That's the question of the year. So, that's a very interesting question because in this day and age, with all the technology, people still find their primary care doctor by word of mouth. That's how they still. I would say you could start with the insurance company because a lot of times you'll get somebody on the phone with the insurance company. A lot of times, if you get an intuitive person that you're talking to on the phone, they will tell you who a lot of customers who they talk to are going to and like. Because when insurance people, the customer service people tell them, and so they get a lot of insight. That's a good question. How do people find a good doctor? please, because I'm at a loss right now.
Well, you can give them your phone number for one thing. But I didn't give her her phone number. So I would say since COVID, right, there was that highlighted that there were so many disparities, especially within the Black and Brown community for care. So I'm in Montgomery County, Maryland, and there's a thing called the Black Physicians Healthcare Network. Yeah, so that was created during COVID, and it's a consortium of not just doctors but other healthcare professionals, RDs, physical therapists, etc., that are committed to culturally coordinated care. So that's one place I would say, especially if you're Black or Brown, to go and look. And they actually have care coordinators that can help you. If you're outside of Montgomery County, it should be expanding actually to the goal is to get it to Prince George's within the next year, and then hopefully to the DC area. But outside, there's blackdoctor.org is another place, and they have like a listserv, and you can look that up as well. The National Medical Association has one too. Other places, okay. So those, I know blackdoctors.org is open. I know Black Physicians Healthcare Network are. There are other online sources too, like ZocDoc. Have you seen? Yeah. Good.
Is it on? Yeah. Edit. And this has, oh wow, I'm just going to read these. And this has mental health in it as well. Therapy for Black girls, health in her hue, blackdoctor.org, QD Coe, HUE_DCO.com, findablackdoctor.com, blackdoctorsusa.com, blackdoctors.us. And then also, as far as finding a Black therapist, you can go on Psychology Today and you can filter for African American.
Does that help, or you have more of follow up to that? Okay, good. Okay, alrighty. So what we'll do now, so Dr. Coe, have you been thinking about your final word, what you want us to readers to take away if we get nothing else from this book?
My final takeaway is that you have the power to have a say in your health. You have a lot of power to control what your health is. You have the ability to not just be a passive recipient of healthcare, but be an engaged partner with your doctor and help your doctor manage your healthcare. But it is work. You have to come to the relationship with your doctor with knowing what your medical history is, knowing your family history, knowing what medications you take, following the doctor's instructions. When you get your blood drawn, look at them. A lot of people get their lab results and don't even look at them. And so all of that is just being an active recipient of healthcare. Ask questions. A lot of people receive help but don't ask a lot of questions. Go get reputable information if you're going to use the internet to ask questions. And try not to just Google information. Try not to put too much stock in what people say on the internet because it a lot of times it doesn't apply to you as an individual.
Well, thank you. I will say so much for writing this book. Thank you, audience, just for your questions, your engagement. Dr. Coe will be around signing the book. I highly recommend you get it. Get a few for your friends. I've already given them to patients. So thank you all so much.
Thank you, everybody.
All right.
It's a guy, I think. No, I think it's like this place. Let me see if I recorded. I thought I was doing stuff. For the list. No, I didn't record that. I mean, this I heard I was doing.
Since you gave a whole list, I asked a question about the recommendation for decisions, and she gave a whole list. I was wondering, if, I don't know if you're still recording, was there a way to get the list? I got some of them.
You can get on our YouTube.
Okay.
This is definitely posted on the next hour.
Okay. What's the, so did you get me?
Oh, no.
They recorded and put it on there.
Oh,
And
okay.
so,
Oh, nice. Okay. Did you place the book order? Oh, okay. I was about to say.
I agree.
Yeah.
Oh, no, 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 no. Yeah, yeah, these are officers. Yeah. Wow. Yeah, yeah, I was really having a whole conversation with one of the boys long time ago. Yeah, yeah, I never knew how to sister. I don't see my man. So, yeah, I know. Oh, oh, no, okay. Yeah. Some people yes, sir. Yes, sir. I like it because it's very big. Oh, it's just I like it. It's a very good place. Just pretty much the same, right? Travel to, like, them, right? So some places you have to go here. Then you realize sometimes you guys have to sit down and be careful. Yeah, right. Good conversation. Yeah, eat everything. Well, I mean, if I wanted to, I guess, dates I want to eat, eating some good meat. Sometimes, I mean, I'm with bacon, I don't care to do like turkey bacon. Chicken style, turkey bacon, but when I want them real meat. But going to meat, real meat can be like, so there's no way I can take that out of my life. I moderate it, so I don't do it all the time. So like, I really eat a long time, I do like 3 times, 4 times. But other than that, like steak, like salmon, some other fish. Oh no, that's the worst thing you don't want. Yeah, you don't. No, no. Yeah, yeah. So, so I go to my own primary care doctor. You know, but sometimes I would bounce like, something, a few Sundays here, can you check or something? So it's good and it's bad. Now imagine we have a third. Yeah. Yeah. All right, let's go. You next. Step up, bro. About 2 years. Yeah, 2 years later. No, no, no. No, man. That's what parents do, right? I'm not. You see, I think with here, like, because most of the places, sourdough bread, yeah, yeah. At the same time, we've done, like, we work out, but not work out, like, not necessarily about the gym, but we do a lot of physical activities, like, we do a lot of walking, a lot of stuff, you know. So that's all, because I think they say that long as you walking, you're doing some kind of physical activity every day, you get that simple walking, some kind of movement, part of my health. And you didn't have my watch, you know, nobody would tell you to stand up. Afterwards, I like that, you know, someone that has it off, you know, yeah. Yeah, so it's just all of you. Some people do that. Oh, you know, just some simple thing that